what did you think was missing from the report? What else do you think should have been in there?
A strategy, I think, would have been really helpful. So what we basically have, and like Anthony said, is that we now know about the opening of schools and childcare, but apart from that, there's nothing really new in the revised Living with COVID plan. And I think what people really wanted and what people really needed was that new strategy. You know, the numbers are kind of stubbornly staying at the same pace at the moment. And like you said, you know, the hospitality sector and people, they're not lobbying to reopen, because I think, you know, we've all learnt from how this has played out, how this strategy of rolling lockdowns has played out, and people don't want that anymore.
But is the government not a bit sort of damned if they do and, you know, damned if they don't? If they give dates and then they can't deliver dates because the numbers don't go a certain way, or the vaccines aren't delivered, then, you know, they're accused of getting the message wrong. Totally
understandable, but like nobody would damn them for having a strategy that would be really effective. I think, you know, they wouldn't be damned for doing that at all. I certainly wouldn't be damning them. Like, you know, it says in the new report as well, as it acknowledges that with new variants we have to look at, you know, the risk of the vaccine not being effective on them. So if we take that into consideration in reality, if that's in this revised plan, that, you know, this is a real risk, then what they wouldn't be damned for doing is introducing proper hotel mandatory quarantining. And what they've done is they've introduced it for 20 countries, and that legislation will be going through the House over the next 2 weeks. This was so-called, you know, emergency mandatory hotel quarantine legislation, which has taken 6 weeks. That's not enough in the way of urgency. And I think, yes, everybody wants to see the hospitality sector reopening. They're suffering so much. And like, particularly, say, like in rural areas like mine, you talk about perhaps loads of them not being able to reopen. If you take, for example, a hotel in a rural town or village, that is the heart of the community. It's the biggest employer. They, you know, host all of the weddings, all of the funerals, charity events. Like, it's, you know, everybody wants that, but they're not lobbying for it, because we saw what happened the last time we reopened. So what's the plan? We're going to reopen this time based on what? We haven't achieved a particular number. We haven't made a real or meaningful effort to keep out new variants that, like I said, the vaccine may or may not work on. That I think, like, what the
strategy, I think, would probably at this point, it's the vaccine, isn't it? By the end of June, but 4 months away, 82% of the Irish population of adults who want the vaccine will have had the vaccine. That is the strategy at this point. That was the strategy really in the UK, wasn't it? And it does appear to be working over there.
The vaccine was a great part of it. But like I said, with new strains, like, for example, the P1 variant, we don't know how the vaccine responds to that yet.
But what sort of strategy do people want from another point of view? I mean, outside of the zero COVID strategy, which Australia and New Zealand are following, and maybe a handful of other countries, no other country has really cracked a strategy for living with the virus. I mean, it's the great failure of people who always argue against lockdown. But it's, you know, what is the alternative? No country has managed, with the exception possibly of the Norwegians and the Finns, no country in Europe has certainly managed it. The sort of, you know, I think there's way too much of a focus on mandatory hotel quarantining as some sort of a silver bullet that's going to bring us to some position. I mean, at the moment, the reality is that the reason why we have such high numbers here is domestic transmission. It's got nothing to do with the virus coming, or very little.
It's literally just factually incorrect. So there's very recent science, you know, research that's been done on this, scientists and doctors together, and they found that after the first wave, we really suppressed the numbers down so much. So we had 4 cases a day in July, and in the second wave, they checked, and in the second wave there was one case of the variants that were seen of the first wave.
We had 600 cases a day.
Because of the B117 variant, that's 90% of our cases now. So
I just want to
say that it's just, you know, just keeps spreading around in here.
There isn't a single country in Europe. There isn't a single country in Europe doing what the Social Democrats wants done, which is mandatory 14-day quarantine.
Does that mean that we shouldn't do it? Because somebody else isn't doing it.
That Ireland,
we've seen what works
Ireland
globally,
is a small country,
and it's been a year now of rolling lockdowns. Why would we not just look at what's worked and adopt that method?
Sure.
We believe in science. It's not outlandish.
Sure.
To let Anthony stay, I think you were listening in there, Anthony, and looking to get back in.
I mean, very, very bluntly, this is a really high-risk approach. Germany, we've been asked by German public health people, why has Ireland not done zero COVID? Because we're the most obvious place in Europe to do it. The no-COVID movement is gaining political support in Germany, and they've closed their borders with several other countries in the last few weeks.
They haven't closed their borders.
All right.
So this is going to be an option for us. If we don't take this option, a substantial number of additional people will die.
All right. Unfortunately, we have to leave it there.
That's our choice. That's the government's choice.
My thanks.